Well, hello to all our quality-minded listeners, and a special shout out to our Mayo Clinic Care Network members. Welcome to Key into Quality, a Mayo Clinic podcast focusing on healthcare quality, experience, and affordability trends and solutions. Today, we're going to be exploring the cutting edge of medical technology and the people driving it forward. We're stepping into a future that's becoming more reality than science fiction, one where robots aren't just performing surgeries or diagnosing conditions, but are an integral part of the daily rhythms of our healthcare facilities. Thanks a lot for joining us. I'm Dr. Tim Morgenthaler, a professor of medicine here at Mayo Clinic and a vice chair of Mayo Clinic Quality. Co-hosting with me today is Sherry. Sherry?
I will say, well, hello to everyone too. I'm Sherry Nemick. I'm the consultation relationship manager for quality at Mayo. And today's topic is going to be a fascinating one because I don't know about you, but it seems like technology, robotics, whatever in healthcare changes every day.
I am such a fan of science fiction, but the science fiction of my formative years is the reality of my current years. And
I was
I
thinking about the Jetsons.
yeah, so just imagine, if you will. Now, when I say this, you're going to start seeing a black screen with letters scrolling by, but just imagine a scene straight out of a galaxy far, far away. There's a critically injured warrior unable to care for himself. He's saved not by a human doctor, but by a reprogrammed droid, a machine that was once a tool of destruction, now reimagined as a compassionate healer. I'm talking about The Mandalorian. So yes, it started with Star Wars, but I have been watching all of the series. This is IG-11, a once deadly assassin droid who ends up becoming a nurse and expertly treating the hero with calm precision and care and all those human qualities. So, while we might not now have nurse droids roaming the halls of our hospitals, not just yet, but we are on the brink of something that I think is equally transformative. Logistical robots are starting to find their place in healthcare, and they're doing much more than just carrying supplies. They're shaping the way we think about efficiency, safety, and the overall experience of both patients and staff. So today, I'm really excited to be joined by someone who's right in the forefront of this revolution. Carl Freiholz is a member of our safety team at Mayo in Rochester, who, believe it or not, is helping to integrate logistical robots into our facilities with special attention to something that's kind of a Mayo Clinic project called the Hospital of the Future. So I can't wait to dig into how these robots are not just easing the burden on healthcare workers, but also maybe elevating the quality of care in the future, a lot like IG-11 did in that kind of memorable scene from The Mandalorian. So Carl, let's get started. Tell us about yourself, your role as a safety coordinator at Mayo Clinic.
Thank you very much. So my name's Carl Freiholz. I'm a safety coordinator at Mayo Clinic in Rochester. So I've been working in the safety field for a little over 20 years now, and started out in electronic components manufacturing, flexible circuits, that environment. About 18 years ago, I was lucky enough to start at Mayo Clinic as a safety associate, and been very happy with my career here at Mayo. Been able to work with a wide variety of groups and people. So I've covered areas from environmental services, Department of Lab Medicine, research, radiology, and now more into the facilities aspect of safety. So one of the things that has been very interesting lately is some of the IT things that I've been working with. So I'm the IT focal point for my work group, and we're always looking at new processes, new technology. One of those big new technologies that's coming into the healthcare world is robots. So Unbound, as you mentioned, was looking at the hospital of the future. And there's a group that was put together to look at robots and how they can be integrated into some of that healthcare of the future. So I've been invited to join that group and help facilitate some of the safety aspects related to that.
I'm just really glad that you're bringing this topic to us. I think so often our listeners and my colleagues, when we think of technology and IT, everything's artificial intelligence right now. And we think about probably something that we interact with a screen in front of us. We're asking questions and the AI brain in the sky is bringing down knowledge for us. But the other evening, I was kind of leaving work a little bit late, and I'm cruising the hallway on the way to the parking ramp. And oh my gosh, there's like an R2D2 like robot roaming down the halls. I mean, it really woke me up. So
Surprise!
Yeah, I know, surprise. So, as we talk about the hospital of the future, what are some of the ways that Mayo Clinic is thinking of using and integrating logistical robots? And actually, while I'm at it, tell our listeners what a logistical robot is.
Logistical robots are a tool that can be used to move things from point A to point B. So a wide variety of things can be moved in a logistics aspect. And if we can use robots to do that, we'd like to try and integrate those into our work area.
Just to pick up on what Dr. Morgenthaler said, are there specifics that you've been talking about in the hospital of the future that are maybe coming?
So right now it's a lot of supplies. So right now there's people that take carts of and boxes of supplies from the dock to each individual work unit.
Mhm.
So we can try and minimize some of the foot traffic, try and reduce some of the burden on those people by using robots to at least stage things and get things moved from the dock to maybe a staging area so they can be more efficient in moving and stocking those supplies. That's one of the
So,
big areas
yeah,
right now that they're looking at.
thanks. So, just to dig into that human part a little bit more. So, I know sometimes people worry about, oh, the robots are going to take over and nobody will have jobs, right? So, where does the human fit into this new era of robotics, and how do we help prepare our workforce for that?
So we're always looking at ways to help the current employees. We don't want to take jobs away. The whole idea is to how can we make that job easier and more efficient for those people? So it might be making less steps. It might be moving heavy objects that they no longer have to lift anymore. It's just a way to make their job easier and more efficient, not reduce the number of staff that's required.
So, I would imagine that's a real benefit to staff and part of how you talk about how robots can help them.
So ergonomics is a huge thing when it comes to material handling. And if we can reduce things that people have to lift and move and get rid of that manual handling, that will reduce the number of injuries for our staff. So that is a
Right.
big deal. And the healthier we keep our staff, the better it is for everyone involved.
Carl, I have to think that there's a little bit of skepticism on many people when we say, well, this isn't going to replace, people's work. It's going to augment their work. But I think in reality, there are some jobs that are very well suited to these logistical robots, like just moving supplies, as you said, from a loading dock, maybe to some destination way on the other end of the hospital. But I guess what I'm thinking is that the people that used to be trudging the hall with this thing, that they would need to be upskilled, and it would allow them to do something that maybe is much more attuned to their capabilities and adds even more value to the system. I don't know. Do you have stories from the staff where they've seen benefits of using robots?
Some of the things that people have to take when you look at robots is somebody has to be able to program it, maintain it, teach it. So those are all things that jobs might transition into a little bit. But as far as things that people are using them for now and success stories is just getting things from the East Logistics dock, the new facility on the east side of campus. It's a long ways down the hallway. They can move things from that unloading point to about halfway down the Eisenberg hallway, and it saves a lot of time. So then somebody can pick up that cartload of supplies and take it from that staging point. So it's a time saver in when it comes to the supply chain side.
Well, and we
Another
know
area,
it's difficult to get people to work, you know,
that,
that there's
yes,
open positions, and I have to believe that this will help offset the challenge of finding people to be able to do those jobs.
definitely. One thing to be very cautious of is we don't want to bring in robots just to bring in cool robots. They have to have a purpose.
Sure.
So they still have to be integrated into the work area. They have to make things more efficient, not less efficient. So as far as the human factor and how people are working with that robot, we definitely need to have the people there to be able to manage the robot still as well. And they have to serve that purpose.
I've seen some what I might call experimentation along those lines, both here at Mayo and then some implementations at other healthcare facilities. I keep on talking about I'm walking around the hospital in the evening, but that just happens. And I was getting off the floor I think on the fourth floor in the Gonda building here, and lo and behold, there's a little robot there that's taking laboratory samples from a procedure area over to pathology, which is several buildings over. It's a long trip. They got to go down to the ground floor and over several buildings through our underground, what we call our subway system, and then back up to another building. So I've seen that. When I was visiting a brand new hospital in Singapore, I saw that they had built into their ground level floor food delivery robots. So the trays would be loaded from the kitchen area where patients' food was being prepared, and then it would be delivered quite rapidly underground to the nursing station where the patient was, and actually delivered up to the very unit that the patient was in, all robotically. So I do think that these are going to really facilitate delivery and transit of goods and supplies. And as someone interested in quality, and many of our listeners are quality improvement specialists, when you think about what are the wastes that you're trying to drive out and lean, transportation is one of them, transport. And so robots really may be helpful in that regard. I'm wondering, how do you think that these robots are going to change the dynamic of clinical care? How are they going to improve the patient experience?
Well, if you have a robot doing a task that a person no longer has to do, that person can be focused on the patient in the unit. They don't have to leave the unit to go down the hall to a storeroom and get new supplies. They can have supplies or food delivered right to that area. So that's more face time that they can have directly with that patient. So
Yeah,
it creates an opportunity for the staff to be right directly with the patient more often.
yeah, we know how much that even creates a better staff experience because there's so much more meaning and purpose in being with your patient than having to run to a supply closet, however far away. But
Yes.
let's talk about the lens of safety. So, what are the unique aspects of robotics that you've had to consider from a risk assessment standpoint?
So there's a lot of different things that come into play when you talk about robots. Just in how they move is one thing. How fast are they going? How much do they weigh? How can a person move them if they have to? How do they get through secure doors? There's a security issue there. Do they have to badge through? How do they use an elevator? So that's also another safety concern. Does it block a person from getting into an elevator, or are they working with that person to get through the elevator door? There's a lot of other safety factors involved as well. Does this robot have any moving parts? Does it have an arm that swings or moves? Does it have drawers that go in and out that can become pinch points? What is the battery type? What's the chemistry involved with the battery? How do you charge that battery? Where do you charge that battery? What does this robot do in case of an emergency? The fire alarm goes off and a lot of the automatic fire doors close. Then what? Where does the robot go? Does it just sit there and block the hallway? Or will it have a designated point that it can be redirected to? Or is it light enough and easy to move that a person could just move it out of the way? Those are some of the safety things involved when you're looking at robots. Another thing is ergonomics. How does a person interact with that robot? Is it a screen that's way down low that a person has to push buttons and bend over and have an awkward angle to interact with that robot? Or is it up and in a good ergonomic position that a person can easily interact with it or program it? A wide variety of things like that that we need to take
So
into
you mean this isn't
consideration.
actually all that simple, is it?
No, no, not at all. There's a lot of factors that go into
Complex.
robot safety. So risk assessment that was mentioned earlier, that's another big thing as far as how do you determine what those hazards are? So it's going to vary by use case. So is it moving a box from point A to point B? Is it moving medications? Is it moving food? When you need to look at that risk assessment, and there's a lot of parts and pieces that go into that as well. So the electronics, the mechanical, the physical aspects of the piece of equipment moving down the hallway. There's a lot of different things just from the safety lens that go into that. And that doesn't take into the IT security side of it, the facilities part of it, the electrical parts that need to be in place to charge this piece of equipment. There's a lot more that goes into it just than the staff safety. And when we talk about the staff safety part of it, there's more than just staff that are involved with these robots as well in some areas. Once you start integrating them into patient care areas, you have patients, visitors. Are there children in the area? How do they interact with the robots? Those kind of things. So
Wow.
It's very much case driven for the types of things that you're going to look at, but there's a lot of questions to ask.
Carl, I wonder, as we advance the margins of everything that we do here, technological, biological, pharmacological, clinical in every way, there's always new lessons to learn. And some of them we have to learn by our own, hopefully very safe experimental processes. And other times we can learn from others. Where do you turn? Where does your group turn to learn from others about robotic interactions and safety? Are there others that have been doing this work that you found are useful resources?
So ANSI, so the American National Standards Institute, has a couple different standards out there that are considered best practice. Most of them come from the industry area. So robots have been used in industrial settings for years and years and years. So think of automotive and even now some of the more of the warehousing type things. So there's no real standard that integrates them into a hospital care setting, but we need to take the information that we have from that, kind of meld that into our own risk assessment. There's a very good baseline risk assessment system in the ANSI standards that you can use to help mitigate some of the hazards or define what some of the hazards are, but there's no real baseline yet for integrating into hospitals or robots. So we're kind of learning as we go, definitely.
One thing that just popped into my mind as you were discussing, and I realize most of our discussion here has been about logistical robots, but I think it was about 2013. There's a professor at MIT whose name is Sherry Turkle. Maybe some of our listeners will be familiar with her work. And she wrote a wonderful book. I think she's written a subsequent one. I just haven't gotten around to reading it yet. But the book was called Alone Together. And in it, a substantial portion of it was about carrying machines. She talks about, I think they're called Pero robots that are used in Japan for elder care. And they're kind of like big fluffy animals that then have an AI interface. And, it's very interesting to hear what she's learning. And I imagine others are learning about this interaction with robots, which, again, I confess I'm a science fiction junkie, but it is here today. It really is. It's a great book. And I did hear that she wrote a subsequent one, which I'm sure will be excellent. She's always done fascinating work. So Alone Together. So you've mentioned if other healthcare organizations, as they start to think about this, so they can look at the ANSI or ANSI standards. Are there other places that they could go to fast track their developments?
The integrator or the people that are creating and building these robots, part of the ANSI standards dictates that or says that they should be the ones that are helping to do some of the risk assessment part. So working with the people that are building the robots, there's a lot of knowledge there as well. So they understand the electrical, physical hazards associated with the equipment that they're building. So having them help with that integration of those robots into the systems. They'll understand the programming that needs to go into mapping, tracking, where do these things can and can't go. Working with those kind of groups are very important as well.
Thanks. That's very helpful. So here's a bonus question. What do you think is fun about this work?
I like technology and the newest toy, basically. They're designed to be tools, but you kind of have that fun factor when you're looking at robots. You mentioned the Star Wars type things, and the Jetsons was mentioned earlier. It's becoming our reality. So I like seeing the technology, how it advances, and just finding ways to use that technology. That's what I find it enjoyable.
I think all of us are kindred spirits here. I mean, it's just
right.
fascinating to see how we can use science and technology to really improve our mission, which is caring for patients and populations. So, I'd love to continue this conversation, but we have come to the end of our podcast time. I guess in closing, I just want to reflect that I think the integration of these logistical robots into healthcare settings really offers a lot of promise in terms of enhanced efficiency, reducing human error and maybe preventing injuries. I think it can free up a lot of valuable time for our staff to focus on patient care, as you mentioned. I think as we continue to explore ways to refine these technologies, and I'm sure these robots will become more and more complex, maybe increasing the safety concerns, but also maybe increasing their value. So there's a lot of field to plow out there, as they would say up here in the upper Midwest, and the overall system reliability, will be really important. So by really thinking about how to adopt these logistical robots into our care here. I'm sure I'm going to be bumping into more robots as I leave for work as time goes by. So thanks so much for joining us. We really value the work that you're doing on behalf of our patients and on behalf of our employees, our coworkers here. Just thanks so much for being here with us.
Definitely enjoy the experience.
So to our listeners, we're glad you could join us, and we hope the information provided has been insightful and valuable. Again, Mayo Clinic's Key into Quality podcast aims to highlight some of those first steps in addressing important quality challenges that are in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, we'd be very grateful if you'd leave us a review on Apple Podcasts, a rating on Spotify, or feedback wherever it is that you listen to us. And you can also follow us on your favorite podcast platform. Let others in your organization know about the podcast so that our information can be spread. Until next time, goodbye.